Yesterday, the government announced an opioid emergency task force to deal with the growing crisis around opioid abuse and overdoses. In addition, the government announced $220 million to fight the opioid crisis. Given I've been calling for a task force since last February, I've openly supported these announcements and thanked the minister personally. Today, the Assembly will debate Nick's Law, which would dedicate a portion of Ontario's advertising budget to opioid awareness and education, and in just 36 hours, we have had over 24 signatures on a petition calling for this law to pass. As a show of good faith, I'm hoping that the minister will support this. Can he speak to it?
Minister of Health, Long-Term Care.
Well, Mr. Speaker, I appreciate the member opposite's advocacy on this critically important subject, and it is true. We have had quite a number of conversations, and she has been a powerful, appropriate, and tremendous advocate with regards to Ontario facing a public health emergency with regards to opioids. And Mr. Speaker, and I know that she's doing it from the right place and in the spirit of wanting to make a difference and contribute to all our efforts to diminish and eventually end this crisis. I look forward to the debate this afternoon on her bill. I applaud her for also focusing on the reality that among the many touch points we have to impact this, public awareness and education is a critically important aspect of that. So thank you for the question. I look forward to talking more in the supplementary in detail.
Thank you. Supplementary.
Thank you very much, Speaker. I think I misspoke. It was 2,400 signatures that we got in 36 hours. Nick's Law is named for Nick Cody, who was a teenager when he died by overdose from what his dad said was just one bad pill. The stories I hear every day would sink your heart. Kids as early as 10 years old are taking pills that could contain a deadly dose of fentanyl. Yesterday, I was shocked that carfentanil has appeared on the streets of the City of Ottawa. Just to put this into perspective, it is 10,000 times more powerful than morphine and even stronger than fentanyl, and it's being found on the streets in our city, so we have to be much more vigilant. Will the minister commit to an immediate public health advertising campaign to warn Ontarians against this deadly and potent drug that is now making the rounds in Ottawa?
Thank you. Minister.
Thank you, Mr. Speaker, and we have committed to such a public health awareness and education campaign, and in fact we are implementing it, Mr. Speaker. So we're already working with our public health units, providing them with the updated and necessary materials so that through their ability, including with their partners across Ontario, can provide that critically important information. We're working with the Ministry of Education, Mr. Speaker, and other ministries to ensure in the correct way, in an impactful way, we are able to reach high school students, those in colleges and universities. We're working with the Minister of Higher Education and Advanced Education, Mr. Speaker, and we're also working with our pharmacists to ensure that at the point of contact when an opioid prescription is either provided for the first time or renewed, that individual also have the requisite information. And we're working with our bar owners and our nightclubs so that at that point where we're able to reach those individuals appropriately with the right information, and most importantly with our harm reduction workers for that same purpose.